Good morning, good afternoon, good evening. Thank you for joining my talk on prioritization of vaccines. And really what I want to do is think about how do we maximize the impact based on the resources that we have available. I haven't got any perfect answers because there are no perfect answers. Everyone has different situations, but I want to talk through some of the considerations we need to have. When we think about transboundary and emerging diseases, often the approaches we talk about is getting herd immunity up, and we want it over 80%, 70, 80% in order to try and eradicate disease. And this leads to an approach which really is vaccinate everything as quickly as possible against every strain that's available. In theory, this is fantastic. This is a great thing to strive for and an ideal. But we're faced with resource constraints in almost all situations. Those constraints are different. The amount of available quality vaccine that can really do the job, that is definitely a big constraint. It's not possible to produce as much vaccine as is required at the moment for everywhere. Then we've got the issues of matching the vaccine to the strains. So that's either because the circulating strains are different or because we're using heterologous or homologous vaccines. These kind of issues lead to choices that we are making. We're looking at funding. It costs money to run vaccination campaigns, not just buying the vaccine itself, but the manpower that's needed, the other equipment, the logistical efforts to get vaccine to where it's needed. All of this costs a lot of money. And pure manpower. Having enough people who are trained, who know how to give vaccines, who have the skills and the knowledge. All of these are massive constraints. So when we're faced with those constraints, how do we best maximize what impact we can have within the constraints that exist? We did some work a few years ago with the University of Wageningen in the Netherlands and Dr. Langay and Dr. Ron Bergelet. And this was really interesting. We did a modeling program looking at FMD, in this case, foot and mouth disease. But we based it on a susceptible, infected, recovered model. And we looked at how much it would cost over a period of time. And each quarter in this graph is a quarter of a year, 3 months. So this is looking over a long period of time, 5 years, to see what is the most cost-effective approach to getting disease under control. And we looked at no vaccination, obviously. We looked at using high coverage, basically trying to get everything vaccinated with a high potency vaccine or high quality vaccine. We looked at high coverage with a low potency vaccine. We looked then at low coverage, so doing a much smaller percentage of the animals available, but with a high potency vaccine, and then a low coverage with low potency. This paper has been published, and if anyone wants a copy, please do get in touch with me. You would think that the more cost effective, well, not cost effective, but the cheaper option would be to use a low potency vaccine, which is inherently cheaper to purchase. But actually what you see here is clearly using a high potency, high quality vaccine and high coverage is very cost effective. That's the thing that gets the disease under control the quickest, and over 5 years is going to cost you the least. But the next best option is actually still using a high potency vaccine, but using low coverage. That getting out there with something that's going to get the disease under control very well as a vaccine, but not doing everything, not getting your 90% of animals vaccinated, that is still more cost effective than using a low potency or low quality vaccine that doesn't do the job. And actually using those low potency vaccines can cost more over time than not vaccinating at all. So without prioritization, but making cuts and choices in other areas, actually you can end up costing more in our disease control and letting the disease spread rather than get under control. So this is why we need to think about prioritization. What's the best way to use the resources that we have available? Of course, The question is, what does prioritization mean? There are loads of different things. For different people, it's not the same. You can think about prioritization by country. When we talk in the global level, like we're talking now, EU FMD, we're looking at something that's international, then we have to look at which countries do we see the biggest risks, have the biggest problems. Those are the ones to prioritize. You can think about disease. Is the priority foot and mouth disease, or is it lumpy skin disease when that suddenly decides to jump borders and spread and that starts to cause problems? Is it African swine fever, which we don't even have good vaccines for at the moment? What do we need to do with diseases? Is it by strain? We look in Africa and foot and mouth disease. Do we need to worry about the South African territory strains when those aren't the ones that are causing the majority of the disease and the most serious disease? Maybe those are tougher to get under control, so maybe we should prioritize the ones that we can do something about. Is it by vaccine? Is it by the vaccine type? How is it made? What does it do? Is it by procurement? Procurement teams in countries look at cost. So you can put everything else together, but they're going to go for the cheapest option because they're trying to save money. But that is a prioritization. Or is it by your objectives? Do you want to eradicate the disease? Do you want to get it under control? Do you want to stay free from the disease? All of these questions come to what prioritization means for you as an individual. But it's important to think about these things and be aware of them and know what you're trying to achieve. So how do we then plan our prioritization? Surveillance. That is really important. Where is the disease? And we still don't have enough surveillance. We have cold spots. We don't know where the disease is. We don't know what it's doing. We don't know where the next outbreak is going to come from because we're not able to track everything. So surveillance gives us a good idea of where we need to focus on. Forecasting. What is the need? As manufacturers, we're sometimes asked, what is our capacity? In many ways, it's the wrong question. Because we can increase our capacity, we can build capacity, but capacity is dependent on demand. If we don't know what the demand is, we don't know what's needed for the future, and therefore we can't build for it. And that's where forecasting comes in. If we have strong forecasting models, if we know from a country that they're going to need vaccine next year and what volume, and then the year after, then we're able to do something about it. What is your objective? Are you trying to eradicate disease? Or are you just trying to control it? Or are you trying to remain free? All of these things, understanding your objective, all of these things are important. And involvement. Engage the stakeholders all across the board. And that means talking to manufacturers like us, so we understand, again, going back to that forecasting and your need. If we're engaged in the discussions, we're able to think about what we can do to help and support rather than just supplying a vaccine. There are plenty of other areas that we understand or are able to engage with and help. But engaging with people at the local level, engaging with village elders, engaging with the local vets, all of these things, because when we don't do that, we can disenfranchise people, we can drive them away. One example is local vets sometimes see government programs as taking away from their income. If they see free vaccine being brought out, they're thinking this is something they then can't sell. Or if you get a disease under control, then the local vets suddenly don't have a stream of income because they're no longer treating for that disease. So they need to be engaged and brought into the overall picture. What are the possible approaches to prioritization? And there are quite a few now that we've understood. And some of these, the first two of these, are thanks to Dr. Tiziana Lembo and Dr. Divine Ekwem, University of Glasgow. Some work we've been doing with them in Tanzania has shown some really interesting work. One of those is by risk area. And that's been discussed before a number of EU FMD meetings and other FMD research meetings where we've looked at where the risks are and understanding the nodes of connection. So do you focus on vaccinating in local villages where the animals aren't really changing very much, it's fairly static, or do you look at the centres where the animals are brought for trade and purchase and sale, And that's where the disease is really mixing and starting to spread up. So maybe that's where we need to be focusing our vaccination efforts, rather than out in the villages where there's not so much disease driving around. Look at where it's being brought in from, rather than where sometimes it seems like some of the disease is actually happening. So tracking back to understand those nodes of connection. But we also could look at circulating strain. This seems, especially in Africa, really possible. What we're seeing is the different strains have patterns, and you can see waves of certain strains traveling across the country. And that gives us an opportunity to vaccinate ahead, to create barriers. So rather than necessarily trying to go with trivalent, quadrivalent vaccines, which are packing everything in together, maybe we should be focusing on what disease do we think is coming and having a monovalent approach, but vaccinating targeted for what is actually coming. We can look at the time, focus on when movement is occurring. When are we most likely to be able to see those diseases, and when do we know those diseases are actually circulating around? Well, that's a good time to focus on. Now's the time to vaccinate. Well, 2 weeks before, 3 weeks before, so animals are immune, and therefore we don't spread the disease when they're actually moving. And that movement can be driven by trade, it can be driven by festivals, it can be driven by the weather, but every region has its own patterns. Those patterns do change with time. And we need to be aware of those and see. And then also focusing and prioritizing by the vaccine, by the quality and by the type, looking at what is it doing, what's it trying to get to. So in summary, there are limited resources, but what we see is prioritization is definitely cost effective. What you need to think about is, what is your objective? And then once you've got that, then consider various solutions and communicate with all the stakeholders in order to get the results that we require. I hope that this was helpful and stimulates some thought, and I look forward to discussing it further with you.